Okay, good morning, class. So today we are going to continue our entry phase. We have discussed the organizational building phase, the genuine people's organization, elements of your people's organization. Just a bit. Okay, your levels of growth, sub-activities. Okay, so community making, formalization of vision and mission, ratification, organization, and of course your pre-activities we have discussed also. Okay, your come-on activities. Okay, as a continuation of your entry phase, we are going to discuss part 3, which is your training of different members, dry run, the communities, okay, the importance of community meetings. Why do we have to have continuous community meetings and consultations while doing our COPAR, mobilization of committees, and always, as we have discussed, the importance of ARAS. So the ARAS will be continuously done throughout the entry phase. Okay. We will also discuss the consolidation, strengthening, and sustenance phase for today. Okay, we will describe it. Okay, we will look at indicators, internal and external, to determine if the organization is getting stronger, getting weaker, if its activities are being effective. And we will also discuss the critical activities. So until dito tayo, okay, sa replanning, okay, in terms of our scope for our lecture for part 3 today. Okay, so yeah, the notes will be sent in your group chat. I will be going to my slides here. Slideshow. Okay, so NCM 113A, entry phase, part 3. So this is going to be a long lecture for the entry phase. So I think we will have 2 or 3 more parts. So aabot ko ng part 5. Okay, we were able to discuss ARAS, the activities that we do upon entering the community. And yes, it is the longest because it is this is actually already that application part. Okay, and of all the plan, including the planning and the implementation of our plans in the community. Okay, so in this part 3, we will talk about community consultations. Okay, why do we continuously do community consultations? What is consolidation? The strengthening and sustenance phase. So since this is the longest, what we call this longest part of the phases of COPAR, okay, it has to be strengthened, okay, in this part and must be sustained, okay, kaya sustenance phase. Okay, actually the community consultation part here is just a review. Okay, so why do we do community consultations? This is the very first of the series of meetings where the household representatives and the health agency, okay, your group of healthcare workers, of nurses, student nurses will meet together in order to formally know each other. Okay, so yes, we have already implemented the come-on activities. Okay, the initial activities we have already met. Okay, but similar to our courtesy call. Okay, the difference here is we are meeting members, okay, all the members, each representative of a household already. So there is already a bigger group, okay, a wider scope of the community. Each of the houses are represented already, and you really have to get to know each other. Okay, introduce yourself formally, informally, but at the same time, it is really getting to know each other. Okay, because these are not the leaders, not only the leaders of the community, but also the members of the community already. What do you talk about? You share visions. Okay, you share your mission, your objectives. Okay, you can discuss to them what do you want to do after the initial project you have done. Okay, what is the long-term plan. What are the long-term activities that you would like to implement? So you share your vision, your mission, your objectives in relation to the health and development based on the studies and researches that you have done in their community. But at the same time, when you say share vision, mission, and objectives, it is also them, okay, sharing to you what is their mission, what is their vision, what would they like the objectives to be. Okay, so this is not only one way. It has to be, you have to listen from them also. That's why it is a consultation. Okay. Objectives of community consultation. Number one, to get the people's collective ideas and feelings about the entry of your agency in their community. Okay, so yes, you've been there for how many weeks already? Siguro 2-3 weeks. Then you've implemented your initial or come-on programs already. Okay, so you were able to at least get a feel of how to do things in the community. Now, during the community consultation, you would like to get their feedback. Okay, so like we were, good afternoon everyone. We've been staying in your community for almost a month. We've already implemented a few come-on programs, initial programs. We would like to get your feedback, okay, your honest feedback, okay, about what we have been doing so far. Are we welcome in your community? Okay, so two types, two answers. It can be yes or no. Sabihin nila yes. Okay, we are very appreciative of what you do in our community when you do house to house with the programs that you have been implementing, or they can say no. Okay, so we know your intentions are good, but we do not really feel comfortable having you in our community. Okay, so medyo may abala, medyo you take up our resources, you take up our time. Probably there are other organizations, or sabihin nila, our barangay health workers are enough. Okay, so probably other communities will need you more. Okay, so in terms of collective ideas and feelings about the entry of your agency, especially whether the agency is accepted or not, dalawa lang yung answer dyan. Are you accepted by the community or not, based on the initial weeks that you have spent in the community? And you will only know the real answer to that if you do a community consultation. Next, objective of community consultation: for the representatives of the health agency to formally introduce its philosophy, principles, and work. After the initial come-on program, okay, so you can link it already. So napansin nyo naman po, based on the first activity that we implemented, okay, that you participated on, that we all worked together. So this is the philosophy. These are the goals that we would like to achieve, okay, in your community. Okay, so what is the philosophy? What is the philosophy of UC in terms of COPAR? Okay, continuity, okay, reaching people who really need the service of UC students. So yung mga principles natin and work values. So it is sharing to the community people. Okay, the preliminary study, okay, we will present the results. To present the results of the PSI, okay, what then are we going to present as results of the PSI? Remember the investigation and study that you did with some of the leaders of the community. Okay, so you will present it now to the members of the community. So nursing students and the leaders of the community did the PSI, the study, the research, identifying problems. Now we are going to show those problems to the people, okay, to the community members. Why are we going to show them the results? Okay, to validate the data. So what do you think about the survey that we have done? Ito po yung results. So tama po ba na ito yung main problem? This is the priority problem. These are the problems that we have encountered in your community. Okay. Letter B, for initial analysis, to identify other concerns. So aside from the data that we have researched or gathered, what else? What are the other concerns that the people during the community consultation would like to share? And letter C, for the community to decide priority problems. Probably based on our computations, based on airway breathing circulation, based on different nursing concepts, we can have our own priority problem, okay, based on our own assessment. But it is more important to prioritize problem that the community thinks is of higher priority. Okay, so it is during the community consultation that the community will decide and give their opinion what are the priority problems based on our PSI. Okay. Another objective of community consultation is for the community to formulate its own vision of health based on the PSI. So we presented to them the problems, the research results, okay, the survey. Now we tell them, okay, what do you think is your health goal now? What is the vision of your community? So you let them formulate their own vision. Okay, you can facilitate it, you can guide them through it, but it's better if the vision, okay, or the objective in terms of long-term health comes from them. So you help the community formulate its own vision of health based on the data that you are presenting them during the community consultation. What else do you want to be objectives of your community consultation? You want the community to identify possible obstacles. Okay, so since you have a goal already, we have a problem, we have a goal. Okay, now we want to reach that goal. Okay. In reaching that goal, there can be possible obstacles. Obstacles that the student nurses and the clinical instructor may not see because they are not really from that community. Okay, like transportation logistics, resource logistics, saan natin kukunin yan? Walang ganyan sa barangay namin. Walang masyadong malayo yung hospital, for example. Okay, so let them identify possible obstacles that we cannot see. Okay. Also, we want the community to formulate solutions for the obstacles. Okay, if they are the ones giving the solutions, it is easier, or it is a what do you call this? The possibility that they will do the solutions is higher compared to when someone is giving them the instructions. Ito po yung kailangan niyong gawin para ma-solve yan. You can suggest, yes, okay, but it is easier if the community will be the one to formulate solutions, okay, from inside their box, from inside their community. Okay, and it will be easier for them to implement these solutions to take care of the obstacles that you will encounter. We also want the community to collectively decide on activities. Okay, so majority. You want the majority to decide. Okay, what are the choices? The choices can also come from the community. Okay, in terms of options, you can facilitate, you can suggest. Okay, but when it comes to decision making, you let them vote, okay, and decide, okay, what activities that they would like to implement. Do not dictate, because once you start dictating solutions, once you start dictating activities, okay, they may the participation can start to decrease. Okay, remember, we are already in the middle of our entry phase. Lastly, you want the community to formulate communities and action plans. At the beginning of our entry phase, we were able to identify leaders, delegate leaders, okay, based on what we observed. So we went around the community, we saw that Kagawad ABC, Kagawad Jose, Kagawad Marites is very active. So we were able to identify potential leaders. Okay. At the middle of our entry phase, we want the community to formulate committees and action plans on their own. We can facilitate, yes, but if they are doing it independently, that would be a better goal. Okay, so these are some objectives that we want the community to do. What else are the objectives during the community consultation? For the community to share their beliefs, okay, about the characteristics and qualifications of a good leader. So you want them to voice out. You will facilitate. Okay, now that we have all these projects, we have all of these committees. Okay, yes, we have your barangay captain and kagawads, okay, but they also are busy, okay, with some of the activities within the community, within the barangay. Okay, so hindi lang puro health ang magiging focus nila, so we also have to have our own separate leaders for the committees that we are setting up in the community. Okay, so we ask them, what are the beliefs about characteristics and qualifications of a good leader. Okay, so yung mga projects that we are about to facilitate, projects that you have planned out, what do you think are the characteristics of a leader? Must be responsible, must be resourceful, okay, he must know the ins and outs of our community, must be friendly, approachable, etc., etc. So let it come from them. Okay, he must be respectful, okay, approachable, etc., etc. Okay, let the people dictate why, okay, and what are the characteristics and qualifications of a good leader, because we are choosing a leader. We want a leader to lead our committees, health activities in the community. Why must the characteristics come from them? Remember, we are facilitating. Okay? If we facilitate these ideas coming from them, we can use it. Okay, once we have asked them to voice out, okay, what is an ideal leader, then we tell them for the community to select among themselves people who have those characteristics and qualifications, okay, with what was discussed. Okay, so yan, sa mga nabanggit nyo na traits and characteristics, okay, that we need in a leader. Okay, sino po dito sa community natin ang ma-identify natin na may characteristics, those characteristics, and we will vote them as leaders to lead some of the committees and projects that we have identified for our community. Okay, so it comes from them. We ask them the traits of a good leader. Okay, we ask them what are the good projects. Okay, so ganun din. Sila rin ang magfa-facilitate ng mga projects. Sila rin ang magfa-facilitate ng mga pagkuha ng resources, and even the leaders, it will come from them. Okay, so those are some objectives of your community consultation. Why we do community consultations. Okay. The next part is your consolidation, strengthening, and sustenance phase. Okay, this is the stage where we go back to the people's organization, your GPOs. People's organization has been fully established. They are functioning already. Okay, different committees are already capable of doing their own assessing, planning, implementing, monitoring, evaluating. Okay, so this is the consolidation, strengthening, and sustenance phase. Remember, this is in the middle of our entry phase already. So this is the long haul already. Kumbaga, this is in nursing. Ito na yung second, third, and fourth year mo. Okay, so ito yung pinakamatagal. You have to sustain, you have to strengthen, okay, your endurance and finish the race. Okay. Okay, so in this phase, okay, there are indicators. How do we know? How do we know that the organization is already self-governing? How do we know if the organizations that we have set up are already improving, getting better? Okay, so there are indicators. Okay, if they are sustaining, if they are growing, kumbaga. Okay, so you have 3 indicators. Okay, so in this part, we are going to talk about internal indicators, the indicators within the organization, external indicators, the indicators or key signs from outside the organization so that we will know that it is growing. And lastly, we are going to discuss activities that keep the organization alive and stronger. Okay, so with the committees that we have set up, with what do you call this, main organizations, to overlook those committees, how do we know that everything is improving, growing? Okay, and basically we want our committees to live as long as possible, because if the committees are sustained, okay, the projects will also be sustained. Okay, so let's start with the internal indicators. Okay, so attainment of the goal of social transformation as manifested by enhancement of positive values and lifestyle, positive changes of unhealthy beliefs, okay, the practices are improved. Okay, so attainment of goals and social transformation. Okay, what are the examples? Enhanced value systems, practices. Okay, so what are enhanced? Yung bayanihan. Okay, so nung nag-start tayo sa community, pwede nagkakahiyaan sila. But as we strengthened our projects within the community, nagkakaroon na ng bayanihan. Okay, golden rule. Okay, they are doing already to their neighbors what they want done unto them. Okay. There is also an increase in self-reliance. So dati, lagi silang pupunta sa barangay para humingi ng gamot. Now, they can already, what do you call this? They can treat their children with the use of home remedies at home. They can start to assess their children if it is necessary to bring my child already to the health center or kaya pa dito sa bahay. Okay, so there is self-reliance already. Aside from an increase in positive values within the community, there is also a decrease in negative attitudes and a modified changed belief system. For example, crab mentality, nababawasan. It transforms to helping relationships. The colonial mentality becomes a nationalistic orientation. So we do this all for the barangay instead of just doing things for myself. Okay, they start to focus on curative health orientation. They start to focus on preventive, okay, preventing illnesses, okay, preventive methods of preventing illnesses, disease prevention, disease orientation. So mas nagiging aware sila sa mga illnesses kahit wala pa sa katawan nila. So it helps them prevent diseases. Negativism. For example, in terms of vaccine, okay, kung negative ang connotation nila sa vaccines, nagiging positive na. They become more open-minded. They tend to listen more. Okay, so those are examples of attainment of goals by social transformation manifested by positive values. Nadadagdagan yung positive values, nababawasan yung negative values. Okay, what are the other internal indicators? Organizational structures. Ibig sabihin, the committees, the organizations that you have set up are more formal. They are decentralized. Ibig sabihin, there is no one specific person giving instructions to everyone. So it means that each organization, Group A, Group B, Group C, Group D, is being independent on acting on their own. Okay, so hindi na sila kailangang utusan. They are more, what do you call this, independent in terms of decision making and acting. There are a lot of functional communities. Okay, and if committees have to be subdivided, for example, o dalawa kayo, punta kayo sa bahay na yan. Kaming dalawa dito sa kabila. So that is subsectoring, okay, of your committees. Okay, so if the organizational structures are more organized and are more functional, okay, more active, you can see that these are internal indicators that your community groups and committees are growing. Another internal indicator, okay, is that the 4 major principles of COPAR are evidently being observed. Okay, so what are the 4 major principles of COPAR? Mass-based group building, consensus building, experiential sharing and learning, evidence of self-reliance. When you talk about mass-based group building, okay, here is where the leaders work with people and are capable of doing, utilizing resources, preparing project proposals. They are handling the ARAS activities on their own. What else? Negotiating conflicts, okay, mass-based group building. So the groups are able to fix if they have internal problems. Okay, they are building alliances and networks inside and outside the community, and they have developed their own value system. Okay, yung nagiging ayun nga, mas may bayanihan na, mas may cooperation na. Okay, that is your mass-based group building. Consensus building. So what are we trying to point out here? The decision is made by majority of the people in the community. So ano yung naka-benefit sa marami kung ano yung gusto, okay, ng majority of the people, that is what will happen. Because opposite ng consensus building is only the influential will decide. Okay? Only one specific person or a group of people will decide in the community. Ang gusto natin kung ano yung magbe-benefit yung karamihan, yun yung mangyayari. Ay, ang i-implement natin. Okay? Experiential sharing and learning. So you want the people to share their thoughts and ideas. Okay? Express. Let them share what their opinions are. Okay? At the same time, you want them to learn. Okay? Experiential learning, okay, is being able to learn from actual hands-on experiences while the activities are being implemented. And evidence of self-reliance. Okay? They become less dependent on the student nurses. They become less dependent on the barangay officers. Okay? But either they're able to maximize the resources already, or because they are learning more and more from the student nurses, is that they try to apply what they are learning on their own, okay, sa mga families nila. So that is evidence of self-reliance. Okay, other internal indicators, okay, if the needed resources are available. Remember, during the planning, sabi, what are the resources we need in order to implement, okay, the projects. Okay? So we know that the organization or committees are growing if, okay, the needed resources, okay, the resources needed in order to facilitate their programs are available. Okay, so you go, for example, in the clinic, nandun na lahat. Dati wala yung mga medicines, medical supplies, they don't have their teaching aids. But if the resources are available, you know that they are working and they are growing. Improved capabilities of health service provisions. Okay. If the health services are improving, of course, that is an indicator that the organization or the committees are improving. Okay. So dati, hindi marunong mag-BP yung mga kagawad. Pero since you train them, marunong na sila. So there is improved capabilities of health services. There is a dynamic relationship among leaders and members. Okay, so remember, you are in the middle. You want the members to approach the leaders and express their ideas. And you also want the leaders to feel approachable. Okay, so gusto mo, despite being leaders, you want the community members to know that your leaders are approachable. You can talk to them. Okay? You can ask for help directly from them. And there is a relationship already. Okay? You know that the committees and the community is improving and growing. Other internal indicators. Learning insights are derived and put into practical daily use. One example is your ARAS. Action, reaction, action setting. Okay, so what are we going to do here? Excuse me, sorry. Remember, after every ARAS session, after community consultation, there are insights to be derived. If those insights are placed, okay, into action, okay, those the insights are included in the plans. The insights are applied for improvement. So we know that these are good internal indicators that the committees and the community is growing. And lastly, leaders and members are capable of doing advocacy work on their own. Okay, so they don't need already the encouragement of the student nurses, okay, and the clinical instructor or the whatever organization, okay, para gumalaw sila. Okay, they are motivated already to do health activities on their own and advocacy work, promoting the programs, okay, that they have implemented and planned for about the health of the community. So sila na mismo yung gumagalaw. If they are moving, the leaders and the members are moving on their own without you telling them to, it means that, okay, the community is really improving. These are internal indicators. Meron pa ba? Yeah. Positive improvement of health indicators. You can see that there is a decrease in the number of dengue patients. There is a decrease in the number of animal bite patients. There is a decrease in the number of, there is an increase of those having their children immunized. Okay, these are health indicators, positive improvements in indicators, specific numbers. Okay? Nagiging mas malinis, okay, yung community. If that is an indicator, yes. Kung plano, if that is a problem that you have identified when you came there, ang daming kalat sa kalsada, okay? Ngayon, nababawasan na yung mga basura, okay, that is a positive health indicator. Letter J, the quality of life of the community folks have improved. So nag-i-improve na. Dahil nag-i-improve yung health nila, of course, all in all, their life will also improve. Nag-i-improve yung mga relatives nila, hindi sila nagkakasakit. Of course, they have more time to work, they have more time to study. Okay, so life in the community will improve. So those are your internal indicators that your community is self-governing, consolidating, improving. Okay. Next, you have your external indicators. Okay. What are indicators outside the organization, outside the community, that will tell you that the community is improving? Okay. So I think there are two here. First is linkages. Okay. Sa Tagalog, connection. Nagkakaroon ng connection. Okay. So in your linkages, there is improved networks and connections outside the community. Okay, so they're having to contact more health facilities outside. For example, dati they had problems with getting blood just in case one of their community members needs blood. Now they have contact numbers of Red Cross. They already have the contact number of the Baguio General Hospital Blood Bank. Okay, so these are connections. For example, they have connected to the city EMS already. So just in case hindi available yung barangay van natin or yung barangay patrol, okay, to transport a patient from the community to the hospital, we already have linkages to the EMS, and an ambulance can come anytime na tawagan natin. Okay, so we already have connections outside the community. Okay. Also, linkages can also mean the community itself. Okay, the community that you are helping is providing assistance to other organizations. Okay, for example, yung barangay na tinutulungan natin, since magaling na sila in one thing, okay, so yung ang gagawin naman natin, the example was the kagawads na marunong na mag-BP, for example. Anong gagawin nila? Makikipag-coordinate sila dun sa barangay, sa kabilang barangay. Okay, the next community beside it. So, tinuruan kami ng mga UC nurses paano mag-vital signs taking, and the kagawads of barangay A will be the ones to teach the kagawads of barangay B. Okay, so nagkakaroon tayo ng assistance. Okay, we are providing assistance to other organizations. So you will see that these are external indicators. Okay, that the community is improving. They are reaching out. Okay, so very self-explanatory, very fascinating. Okay, kung nangyayari sana yun. One more external indicator are the resources. Okay, so as I said, if the organization is able to generate and support needed resources from external, okay, or internal community sources. So once we are able to acquire resources from outside, okay, so pag meron na tayong mga sources ng mga medications, from the city government, from the local government, we are tapping already the resources. So it means that we are really reaching out. Okay? Also possible that whatever resources we have in the community, binibigay natin sa iba. Okay? If there is the word iba or other people, other communities that we are helping, that is an external indicator that the community is really improving. Okay? So those are your external indicators, your linkages, okay, and your resources. If you are getting help from other people, or if you're helping other people, it is a good external indicator. Okay, if the resources are being acquired, or you are even giving resources to others, that is a good external indicator as well. Lastly, okay, so if we know that we are growing, if we know that the organization is improving, okay, what else can we do to keep the organization alive? What else can we do to keep the organization stronger? Okay, first is your organizational diagnosis. Okay, we have to diagnose the organizations and committees in our community. This refers to a review and analysis of elements of the people's organization. So we will analyze, okay, the committees throughout their operations. We will identify strengths and weaknesses. We will determine if an organization is growing and improving, and identify ways of enhancing the organization. So, what are the ways that they are growing and improving? Kumbaga sa estudyante, sa math lang ba siya gumagaling? Or gumagaling rin siya sa anaphysio? Gumagaling rin siya sa pathophysio niya? Sa med-surg? Okay, so we want it to be holistic. Strength and weaknesses. If we identify the strength, we maximize the strength. We identify the weaknesses, we want to strengthen the weakness as well. Okay, so these are organizational diagnosis. What are the methods of our organizational diagnosis? And this will be your assignment. Okay, I will be sending it to you later. Your parabola method, model or method of analysis. You have your SWOT analysis, fishbone analysis, and historical mapping. We will discuss your assignment later, but these are the things that we will be using to diagnose your organizations. What else can we do? Activities that keep an organization alive, replanning based on your organizational diagnosis. Once you have the results of your organizational diagnosis, you review again what are your mission, vision, objectives, then you can replan. Sometimes when you replan, there can be adjustments, and those adjustments that you do in the middle of the game, okay, in the middle of your COPAR, okay, will further sustain, okay, your organization to last longer. Also, you have your strengthening mechanisms. Ito, madaling intindihin yung mga strengthening mechanisms natin. You have your continued education and learnings and trainings. Okay, so if you can send out your organizations for added trainings in Red Cross, for example, in online trainings, di ba? Ang daming nagpapa-online training ngayon. You can do that as well. Okay. Also, we can continue motivation and mobilization. Continue giving them work outside. Okay. So, i-deploy mo sila ng i-deploy, okay, para they are active. Continue motivating them that they are doing good and improving. And value clarification. We have to go back to our values. We have to go back to our missions and visions. Okay? Para alam natin, are we still doing things based on our mission and vision? Okay, that is your strengthening mechanisms. Sustaining mechanisms, developing second liners of core group members in the barangay workers. For example, we will, kumbaga sa basketball, meron tayong first five, meron tayong second five. If we have already identified a first group of leaders, we can identify and train a second group of leaders. An example, if we have trained already the kagawads, who will be the future of the barangay? Of course, yung mga SK, kunwari, okay, we can train them as well. Okay, that is the second line or the next future of members in the community. Barangay workers, the youth, okay, yung mga they call these yappies, young professionals. Okay, sila yung mga next na pwede natin i-train. And identification of next projects and resources. Once we talk about next projects, once we talk about next outings, saan tayo pupunta next, anong gagawin natin next, ano yung papasyalan natin next. Okay, so it becomes motivating for the people to look forward in the future sa mga ma-achieve pa ng community natin. Okay, that is your I'll go back to the first slide. Okay, that is your community consultation and your consolidation, strengthening, and sustenance phase. Let's go to the assignment. Okay, because what did I say earlier? One of the important things that we will be doing in the sustenance phase is okay, to do organizational diagnosis. Okay. And what are the four types of organizational diagnosis that we can use in our community? You have your parabola model, SWOT analysis, fishbone analysis, and historical mapping. This will be your assignment and it will be submitted through Canvas. Paano gagawin natin dyan? So I will do a new share. Okay, this will be sent to your group chat later. NCM 113A assignment for midterms. Okay, so name, sulat nyo, section, group, date. So this is an individual assignment and it will focus on your methods of organizational diagnosis. Okay. Instructions, define in your own understanding. Okay, I know you are going to read it from Google, but I want it to be defined in your own words. Okay, basahin mo sa Google, then what is your own interpretation? Okay, define in your own understanding each method of organizational diagnosis. Okay, and make an assessment based on the different organizational groups you are included as specified in each method. For example, okay, what is one organizational diagnosis is the parabola analysis. In my own words, this is how I define parabola analysis based on what I read on Google. Okay, so I read on Google, tapos I tried to analyze, and this is my interpretation of the parabola analysis. Parabola model helps me mathematically analyze exact values, numbers based on gathered numerical data in a study, like when we gather information in a community. How then will I use those numbers? Okay, through the numbers and parabola analysis, I can also forecast the future. Kung ito yung number nung mga people na nag-participate nung previous activity, and if I do more effort in inviting, okay, I can expect that there can be a greater number. So that is just a basic parabola analysis. Okay, the greater the effort, the more participants. The more vaccinations, the lesser, okay, the people who will be hit, number of infants to be hit by different diseases. Okay, that is your parabola analysis. Okay, what is the organization? The organization stated, for example, for parabola analysis, ang nilagay ko self. Okay, how can I use parabola analysis in myself? I can apply parabola system analysis in myself by analyzing how much I can save with my allowance, for example. What are the mathematical numbers? How much I am given based on how much I spend. So based sa binibigay sa akin, the less I am spending, for example, mas marami akong masisave. Okay, so that's your parabola analysis. I can also do parabola analysis based on time. Okay, how much time do I have for the whole day? Okay, how much can I spend more on leisure? Kung bawasan ko yung online study ko, will I have more time for leisure? Will I have more time playing Valorant, for example? Bahala kayo. Okay, but that is your parabola analysis. If I adjust the numbers, okay, my hours, I will have more time for sleep. I will have more time for Facebook. I will have more time doing chores. Okay, that is your parabola analysis. Okay, so that is my own answer. Okay, binigay ko na. I answered, for example, I already gave you an example. You can change your answers or you can retain that. Okay, for parabola analysis. But yung SWOT analysis, you do it on your own already. SWOT analysis, basahin mo sa Google. Okay, then define it on your own. What is SWOT analysis? Then how can you apply SWOT analysis in your organization, which is your family? Fishbone analysis, read in Google what is fishbone analysis. Okay, define it in your own words. Okay, and how do I do fishbone analysis as a member of my school in classroom? Okay, in my school studies, in my school plans, how do I apply fishbone analysis? So write it there. Last is historical mapping. Okay, historical mapping in your organizational analysis, define it. Okay, then read it, define it on your own. Okay, tapos how do I apply historical mapping sa group namin? Okay, how do I improve my group based on historical mapping? Ano ba tayo nun? Ano yung alam natin? Ano yung mga nagawa na natin that help us, okay, in the past, nagawa natin sa past that helps us become a better group in the future. So how do you do that? Okay, in your duty group or in your class groups. Okay, so apply historical mapping. And the last question, which among the 4 organizational analysis methods do you like most? Okay, which seems to be more effective for the use in the community as a student? Then explain your answer. Okay, save the file, write your answer, save the file, then send it on Facebook. Okay. You share. I'll go back to my slide. Escape. Go back. Go back to the first page. Okay, so that has been our lesson for today, NCM 138, the entry phase, part 3, community consultation, consolidation, strengthening, and sustenance phase, and using your organizational diagnosis. Your assignment will be submitted on Canvas. I will see you again tomorrow. Thank you and good afternoon to everyone. Stop share.